A bill seeking to curb brain drain in the healthcare sector in Nigeria has drawn criticism from different quarters of society. According to the bill, medical and dental practitioners will be mandated to practice in Nigeria for a minimum of 5 years before going abroad. To get a better understanding on the impact of this bill, we're now joined by President of the Nigerian Doctors Forum South Africa, Dr. Emeka Ugwu, and via Zoom, African Diaspora Global Network CEO, Dr. Vusumuzi Sibanda. Very good morning to you both. Dr. Ugwu, allow me to start with you. Let's talk about the main reason for brain drain from Africa to overseas, and in particular from Nigeria.
Thank you so much. The reasons are multifaceted, and it is always very important to look at the main reasons, because when you have a disease, you don't start by treating the symptoms of the disease. You need to look at the root cause, the ongoing pathology, in order to get to the appropriate resolution and the appropriate treatment. So some of the reasons are, number one, poor welfare services for doctors and dentists. Likewise, any other profession in Nigeria, we have a system of insecurity that is quite rampant in every facet of the nation and in every state of the nation. We have, poor opportunity for further training for the doctors who are there in Nigeria, especially the young ones, who would want to do their residency training. And for those who had completed, also there are limitations in terms of job opportunities within the private and public sector system. Every doctor would want to work in a place that has a more stable economy and political and social system, which is quite lacking in many facets of our nation. So these are some of the reasons, and many more.
Now, how have you received this as a doctor?
You mean the bill?
Yes. What is your reaction? What is the reaction of your colleagues?
The bill is quite shocking. It's very draconian. The bill is anti-people. It even runs foul of Section 34, subsection 1B and C of our Constitution. So the bill is anti-people. So we receive it with all form of negativity. We reject it, and we wouldn't want it to be passed.
Dr. Sibanda, coming to you. So we've just learnt of this bill in Nigeria, but similar laws are being instituted in Zimbabwe, where medical personnel are being prevented from leaving the country to seek their fortunes, if you will. What is your take on how the two countries are looking at dealing with this brain drain?
Well, look, it's very unfortunate. I think just like what the previous doctor said, the problem is that the governments are trying to treat the symptoms of an ailing and a failing, economic and political system. The reason why people go to school and, undertake some training is because they want to earn a living. They want to enjoy, plying their trade. And if unfortunately somebody has been, through training and they cannot get a job or they cannot get properly paid, they will leave the country. And human beings, I think are free to move. It is generally accepted the world over. Of course, we know that these countries do invest a lot of money because they subsidize the education. But it shouldn't. They should be able also to make sure that the salaries, are at least sustainable, and they make people they're attractive, to these professionals.
Now, how do you see this legislation being enforced?
Well, look, it has been enforced in Zimbabwe, for quite, a long period of time. And I listened to the debate in Nigeria, and I think, the same principles might work. If you look at Zimbabwe, it's a statutory instrument where, for example, people are told that if you have trained, as a nurse for 3 years, you must bond. You can imagine such a very, queer word. You must bond with the country for another 3 years because your education has been done for free. And then you are further told that, you must remember that at some stage there was even national service in Zimbabwe for another, for 5 years when you finish school. So you're a doctor who's been, at university for 7 years. You are told you must bond. After bonding, you are then told in order for you to go and work overseas, you must get a certificate, of good standing, which certificate you will not get, or administratively it will be delayed for another year or so before you even get it. So it is very possible. We've seen this being implemented, but to the detriment and the happiness of those professionals, because it is an unfair practice.
Dr. Ugwu, when you look at a nation coming to this decision to pass legislation, which you've termed as draconian, that stops from medical personnel or any other medical personnel from leaving the country, it would almost suggest that they've either exhausted all options for some form of dialogue with the doctors in Nigeria, or they don't actually care.
I think the latter is the case in our situation, because I read the position of the Nigerian Medical and Dental Council. There was a communique issued and signed by the President and also the Secretary General of the Nigerian Medical and Dental Council. So in that communique, they were stating that there was an interministerial committee that was set up to look at the major causes of brain drain from Nigeria, which is not common to Nigeria as we are speaking now. And all the factors raised, all the issues raised, and all the implementations that were proposed, not even a single one has been attempted, by the interministerial committee. And this has been going on for so many years, so it's not a new thing. I left Nigeria in 2005, and by then people had already started to live in droves.
So what are some of these things that haven't been implemented?
Nothing has been implemented. That's what I'm saying.
What were the expectations? What are the things that you were expecting to be implemented that haven't?
Okay, some of the things, just like I spoke, we need to look at the causes. One of the major causes are when a doctor finishes in Nigeria, likewise quite a number of other African nations, there are not enough spaces for residency training, for example. So you need to create proper spaces enough spaces
build
for
more
people.
hospitals.
Yeah, build more hospitals, employ more consultants who are also living in droves. So you need to also make sure that you remunerate the doctors properly well and the dentists. In a situation whereby a member of House of Assembly receives 5 times or more the amount that a doctor receives, and the training is not as high. If you look at the number of years of training, so what incentives, what is the driving factor, what will keep a doctor in a country, in a situation where you have insecurity quite rampant in every section of the society. So these issues need to be addressed, but let's limit it even within the medical fraternity, within the medical company, so to say, So you need to provide proper welfare for doctors. If you say that the salary of a doctor will be at par with that of a member of a House of Representatives, for example, or any other politician who is making these bills, and you make sure that there are proper welfare packages. For example, you make sure that a doctor can easily get a car and a house after the lengthy years of training. Make sure that there are proper security in the hospitals. So basic things. We are not asking for something quite highfalutin or something that is not brain surgery, so to say. So these are some of the simple things that doctors are asking, the very basic things. So the issue of security is a national problem which affects every other person. But if these basic items could be provided, I can assure them not only that there wouldn't be much brain drain, but there will be brain gain. Some of us who are in other countries will be looking forward to, going home to add value to our health system in one form or another.
Dr. Sibanda, let's talk about the Hippocratic Oath and what it stands for, and the belief that doctors are expected to be selfless and provide the best service, I'd imagine, under any conditions. What does that relationship do to patients and doctors or medical personnel when they have to deal with these issues where they are forced to go to work and not earn what they feel they deserve, and over and above that, they cannot leave if they get an alternative, particularly outside the country?
Well, it creates a lot of frustration, and I think that some of these terms are abused. They are not properly used, because when you talk about a person who's selfless, who's really enjoying doing what they are doing, they are definitely going to make sure that they will work properly if they have a situation where the environment is allowing them to work properly. Now, you can look at a situation, for example, where people are not happy because they've not been properly remunerated. They do not have adequate equipment that they're working with. And you compare those economies with economies like the ones that we have, in the UK now. The UK has moved out of the EU, but it is actually attracting more doctors because, of the work environment and the incentives. Now, if you've got doctors that are not happy, it can be seen in the way they do their work, because definitely it means that the lives of people are going to be in jeopardy. Simply because, one, if they are unhappy, they cannot concentrate. The kind of work that they do is life-saving work. Now, you can imagine somebody who is frustrated having to try and save somebody else's life. and what is the possibility that that person is going to do their work, in the best possible way that they can. More mistakes are likely to take place because they are frustrated. So the important thing is to try and remove this frustration to ensure that, the doctors can, basically concentrate and give the best that they can, especially considering that the relationship between their work and the selflessness and the level of concentration and life-saving, work that is involved is so delicate.
Dr. Ugwu, do you expect the doctors in Nigeria to take their medicine, so to speak, or do you expect some form of a reaction?
There are a lot of reactions from the doctors, both from local and international platforms. No one would want this kind of very constrictive, very restrictive, very self-centered bill to be passed, because it will further even be counterproductive, so to say. Because what this is trying to say is that if you train as a medical doctor for 6 years, many a time much more than that because of the strikes that attend a lot of university training in Nigeria. So let's say a doctor finishes after 7 years or 8 years, then you do your internship for 1 year, then after that you do your youth service for another year, then another 5 years. So what that may do is that it may prevent a lot of young men and women who would want to go into medical training not to do that. So a lot of people wouldn't be happy with such a thing. And moreover, just as my colleague has mentioned, when you finish as a doctor, it's expected that you hit the ground running. You would want a doctor who is mentally very fit, who is physically very fit, emotionally composed, and to do all this, you need a lot of factors that are positive and supportive on your side. So without all these, a doctor cannot function properly, and I don't think anyone would want to function and would want to operate under such perspectives and such environment. So doctors wouldn't take it lightly. But it is our hope that the bill is not going to be passed because there are so many stages of passing a bill in Nigeria. It still has to go through the committees, with the committee now, from the committee to come back to the House of Representatives for a third reading. After that, it may be agreed upon or not agreed. If it's agreed upon, it will still need to go to the Senate. We run a bicameral legislative system, the lower house and the upper house. So the bill is with the lower house. So it still needs to go to the upper house for harmonization or rejection. If they harmonize, then they need to still send it to the president for accent. The president may or may not accent it. So there are still a lot of way to go, and we wish that within that time we will be able to make our voices heard so that the repugnant bill should be stopped.
So obviously keeping your fingers crossed. To Dr. Emeka Ugwu, appreciate your time, President of the Nigerian Doctors Forum South Africa, and joining us via Zoom, African Diaspora Global Network CEO Dr. Vusumuzi Sibanda.